The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to our webinar on Build Accountability, Multi-Sector Roles and Engagement. My name is Kitty Jerome and I'm the Director of the Action Center at the County Health Rankings and Roadmaps program. I'm joined by Karen Odegaard, who will be helping to answer your questions as well as sending out some links via the chat box throughout the webinar.
Hello everybody.
We are excited to be joined by David Weed today to talk with us about the long-time engagement of partners for successful health improvement projects in Fall River, Massachusetts. Welcome, David.
Hi, Kitty. I'm happy to join you on this webinar, and I hope my perspective is helpful to our participants.
First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Thanks to the support of the Robert Wood Johnson Foundation, we have 4 community coaches in the County Health Rankings and Roadmaps program, and their assistance is provided at no cost to you. Please don't hesitate to contact us if you need assistance with a tool, a question, a next step in your process. You'll find this orange box throughout the website so you can send us an email. And next, we want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of 2 parts. On the left, you can see the viewer window, where you will see our screen throughout the presentation. On the right, you will see the control panel where you can interact with us. Please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today. We'll be sure to leave time for your questions. Here's a look at what we're going to talk about today. We'll start with a brief overview of the County Health Rankings and Roadmaps program to help set the stage for our topic today. We'll talk with David Weed about how to build accountability through multi-sector engagement using his examples in Fall River, a Culture of Health prize community, and we'll be sure to take time for your questions to help you put this information to use in your community. And we'd like to begin our webinars with an essential question that you can keep in your thoughts throughout our webinar today. We'll be hearing about different partner examples, as we described, from Fall River, Massachusetts. And so today's essential question is, how can we best motivate multi-sector partners to engage in health improvement efforts across the health factors? As you listen today, we'd like you to consider who you can share this information with, ideas for action that you can take away from this webinar, and what else you need to know to understand to be able to use this information. Before we walk through a brief overview of the County Health Rankings and Roadmaps, we'd like to take a quick poll to see how familiar you are with the rankings model. We're going to launch that poll now, and it's on screen. So if you answer, we'll give you a few minutes. And I see folks are answering now, so we'll come back to this in just a minute, get into our presentation.
We'd like to see about 75 to 80% of you voting, and we're getting right there now, Kitty. So we're going to go ahead and close this. Thank you so much for participating, and then we'll share these results with all of you so you can see where we're at here. We're going to close. Thank you very much. We call these our rapid response polls so that we can share them, hear from you quickly, and then share them back with you. So we can see here that we've got a nice mix of folks on the line who have some experience with the model, who maybe have heard it and heard it explained at least once, and some of you who are quite familiar with this model. I'm going to hide this so that we can move back into our presentation.
Great, thank you, Karen, and thank you for participating in the poll. So for those who have not seen the model or are less familiar with it, we're going to give you a quick overview of the County Health Rankings. So the County Health Rankings ranks the health of nearly every county in every state. For each county, you will find two rankings, one for health outcomes and one for health factors. There are two separate sets of messages to convey with these rankings: how healthy a county currently is, that's the health outcomes, and how healthy a county might be in the future based on the many factors that influence health, and that's the health factors ranking. Because much of what affects our health happens beyond medical care, the rankings underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure kids grow up healthy are top priorities. This on the screen now, you should see our model. The model shows the relationship between policy, health factors, and health outcomes. It illustrates how multiple factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks and the quality of our schools, availability of jobs, access to healthy foods, clean air and water, and our social connectedness. All these things impact our health outcomes. So starting from the bottom, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors shape our community's health outcomes, and we specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes to show how healthy each county is: the length of life and the quality of life. Why do we rank? We rank counties within states to provide community leaders with a tool for calling their communities to action. When the reports are released each spring, they garner a lot of media attention. That in turn provides community leaders with the opportunity to mobilize people from across the community to get involved in taking action collectively, action that is evidence-informed and focused on the community's health priorities, action that will ultimately, over the long term, result in longer, higher quality lives for children and adults in the community. The Take Action cycle is the how within the county health rankings and roadmaps. It lays out the process communities can follow to improve health. So looking around this circle, we see a familiar pattern of improvement. We gather information to assess needs and resources. I'm starting at 1 o'clock on that Take Action cycle on your screen. We set priorities so you can focus on what's important. Find the most effective approaches to address your priorities, and then get to work on acting on what's important. And of course, evaluating throughout the cycle will help improve your strategies and ensure that what you're doing is effective. In the center of this cycle, you'll see Communicate sits right on that dotted line that covers everything, because this communication with stakeholders is essential throughout the Take Action cycle. Also in the center of the cycle is people working together, because we know solving issues like childhood obesity, poor high school graduation rates, or inadequate health care require the wisdom and resources of everyone in the community. So we've got another quick poll now to help us understand how familiar you are with the Roadmaps to Health Action Center. So you'll see on the screen, the questions, and I see you're answering them. So we're going to give, again, as before, just a few minutes until we get to about 75% of the audience participating.
Okay, and we're closing right in on 75% of you voting, so thank you so much for participating in this. We're going to close this poll now and take a look at your responses so you can see those. There we go. So we can see here, and this is, Kitty, you know, I think that this is something that we see often where there's a mix of folks, but usually on the Action Center we're a little lighter on those who have seen this and really used it, which is a big part of why we do these webinars, is to help introduce folks to the Action Center and how they can use it, the tools that are there to support the work, the important work that people are doing in their communities.
Great, thank you, Karen. And absolutely, this is, as I say, the Take Action cycle and the Action Center help to provide the how behind our work. If the rankings give us the information, the Action Center gives us what do we do with that information? What can we do next? And so there are 4 core principles that really form the base of taking action. It takes everyone, all of us working together to improve the health of a community. And we need to move as quickly as possible from data to action, not get stuck in the analysis paralysis or just drowning in the data. We really encourage communities to look to the evidence to inform these actions. If you innovate, of course, be sure to evaluate, but keep focused across those health factors, including the very important social and economic health factors. And not to be afraid to take on the policy systems and environmental change, which will really create the greatest long-term change in health for children and adults in your community. So if you go to the roadmaps part of our site, which is looking at our homepage, on the orange navigation bar at the top, you would select the Roadmaps tab. Then you can pull that down and you'll see the Action Center pops up. This is where you can find step-by-step guides under each one of those categories on the Take Action cycle. And these guides will help you to take action to improve health in your community. They'll provide you additional resources and tools to use in your community. There are also guides there for each type of stakeholder involved in taking action, represented by those blue bubbles that were on the Take Action cycle. So while you're in the Roadmaps tab, you might find some other useful links to the What Works for Health Evidence Database, for instance, and to the RWJF Culture of Health Prize. So we'll give you those links in a chat box so that you can spend some time later exploring the Action Center. The Culture of Health Prize I mentioned, and you might wonder, what is the Robert Wood Johnson Foundation Culture of Health Prize? Well, we guide people to the Take Action cycle and point them toward tools and guidance on our website to assist them. But we also know that many communities are already well on the way on this journey. And so to have a way to identify, celebrate, and feature these communities, the Robert Wood Johnson Foundation Culture of Health Prize was created. The prize recognizes communities annually who work across health factors by defining health broadly, are strategically focused on policy systems and environmental change, and who look out for all, including the most vulnerable in their community. These communities work collaboratively with partners from across the sectors. They use resources wisely and creatively, and they measure and share success widely. The 2014 prize winners just gathered in Princeton, New Jersey earlier this month to receive their awards, and you can learn more about these 6 communities at countyhealthrankings.org/roadmaps/prize. I know Karen will be chatting that web link to you now in the chat box. Also at this site, you'll find the call for applications for the 2015 prize. The applications will be due September 17th. We're going to talk once more about that prize at the end of this webinar. I'm very pleased to note that our guest today is representing an inaugural 2013 prize-winning community, Fall River, Massachusetts. So I would like to welcome now David Weed to tell us more about Fall River. David Weed is the Executive Director of Partners for a Healthier Community and coordinates the Healthy City Fall River Initiative between the Mayor's Office and the Massachusetts Department of Public Health. Begun in 2003, the project is supported by linkage funds from 2 local hospitals and has involved over 1,000 projects designed to improve the health and quality of life of those who live and work in the city. This is all depicted at www.healthycityfallriver.org, and again, you'll have that link in your chat box. Dr. Weed retired after 32 years as a clinical psychologist for the Massachusetts Department of Mental Health, where he worked on a number of health promotion projects for adults with severe and persistent mental illnesses. Dave, welcome. Can you begin by telling us a bit about Fall River?
Sure, Kitty. Fall River is really similar to hundreds of older manufacturing communities across the country. Ones that were once thriving but have fallen on harder times over the more recent decades. Economically, we're struggling as we work on the transition to an information-based economy, but we are making progress, especially in the area of education. Before we move on, Kitty, to more details, I would like to point out that we're not only home to Lizzie Borden, the infamous 19th century axe murderer, but also, on a more positive note, to Chef Emeril Lagasse and Washington Post columnist E.J. Dionne.
Wow, that is a list of diverse, famous residents, I'd say.
Like much of America, Fall River welcomes hundreds of new residents each year from countries all over the world. Our children speak languages, over 32 languages at home, and that represents a major challenge to our education system. And the cultural mix creates both opportunities and challenges to our agencies in promoting healthy lifestyles. Strictly by the numbers, we're one of the poorest communities in a state that overall is doing well economically. Since we know that both income and education levels track closely with health status, we realize that these factors are important considerations when we approach improving health. But our adult smoking rates have been moving down over the past 10 years, and our high school completion rates have gone up in recent years, where they are now above 80% for recent graduates, first time in the history of this education system.
Okay, so you've had some great successes among some pretty familiar, solid challenges.
Absolutely. Our health statistics reflect a population with those challenges. As you can see from the chart here, chronic diseases and conditions like obesity are well above state averages. But I do like to point out that the comparison with Massachusetts is somewhat misleading, in that our average disease rates are actually more reflective of the country as a whole. Not that that's necessarily a good thing.
Right. So as it's reflective of the country as a whole, I think many of our audience members probably are going to relate to some of these challenges. So Dave, with these challenges, we know that it takes many players to work hard to address them, and working together is one of our principles. Can you tell us a little bit more about your partners?
Sure, Kitty. We're currently working with a full list of community entities, police, school, hospitals, etc. But we didn't start with the full list right from the beginning 10 years ago. Health and Human Service organizations were the first ones to the table simply because our health promotion agenda aligned pretty closely with theirs. It's only been over that time of 10 years that we begun working more closely with the police, city government officials, faith-based organizations, and anyone starting out in this process should realize that it takes time to develop trusting relationships and to begin to align their interests with theirs. We always have to remember that health is not really the first order of business for many groups in the community.
Dave, as you're talking, we're going to actually post a poll again for folks about working with people in their community and what kinds of partners they're working with. So we'd like to hear who our audience is working with. But I'd like to also ask you, so can you encourage those who say that their primary work is in a sector not traditionally considered health related, say education, business, planning, politics? What do you say to folks like that to partner with you? We sometimes hear that people claim, I don't actually work in health, so how can I spend my work effort on your projects?
Well, what we've learned is that we have to go to other organizations and their table first. That means we have to invest time to find out what makes their organizations tick and what is highest on their agenda. Once we know that, we can begin to identify areas of common interest and start to develop an action plan that serves both of us. At first, our schools saw us as adding to their already overcrowded educational mission. When we got a Children in Balance grant from Tufts University and were able to come in and offer tangible resources to them, like playground equipment and training for the cafeteria staff, we were in. Though the grant is long over, they now see us as an ally in reaching their educational goals.
Thanks, Dave. And so I'm going to just acknowledge the poll results here that we saw. So we have people working really across all active sectors in their community, there's a really good proportion of that, and so that's really great. If anything, I think the lowest level there is the local funders and business leaders, and so that's an interesting point. Would love to hear more from you about that, Dave.
Well, we're always looking across all those sectors. So, principally, the sectors that are most involved, as I mentioned before, were the health and human service organizations. But we have 3 paid staff members who meet monthly with our steering committee to develop programs and make decisions. And then we have 4 major task forces where most of the work gets done. At any one time, we have about 60 people from around our community working on health issues, including healthcare access, youth development, community health and substance abuse. This includes a broad mix of folks from different organizations who see us as the backbone organization. It's our job to work with the community to identify challenges and resources and to work towards solutions. We do everything in collaboration and work hard to keep the playing field level and cooperative. Much of our input comes directly from the community we serve. Every 5 years we spend months conducting surveys, focus groups, key informant interviews, and discussions on various topics. We just completed our most recent needs and assets analysis, and based on that, the health factors were identified by the Roadmaps to Health approach. This helps people understand why health improvement requires so many different factors that come together to impact the health of the population. It also helps people see the forest and not just the individual trees they're working on.
Great, Dave. Thank you so much. This is Karen, and I'm just chiming in. We had a question from the audience about, you know, as you've started to build these relationships and collaborate across sectors and kind of get your work organized, how have you really built some shared responsibility, shared accountability among the partners who are at the table who you're working with?
Well, that's an issue that we hear from lots of other communities, and getting buy-in, getting cooperation. Part of it is really developing a culture within your community that says that this top value is one of sharing. It's a collective effort. We all work together, and we all share in the benefits and getting the credit for it. But, you know, given that, everybody has egos. Every organization wants to get some recognition for the contribution that they make. But I think what we've learned is that if we partner with people from the beginning in creating the plan, then they're much more willing to stick with us and assume responsibility for different aspects of that. So it really is a process of making sure that everything is shared right from the beginning.
That's great advice, Dave, and I've heard that from successful coalitions previously. I've just seen the next slide on what you're working on. You have a really great range of objectives that you're focused on.
Well, yep.
Go ahead.
I think if anyone goes to our website, you can see the current plan covers, I think, 59 different strategic objectives. But this slide gives you some idea of the range of things that we really have to address in any community to get the needle to move on health.
Mm-hmm. And you mentioned earlier, and you've talked a bit about this, that it's not really about people coming to your table so much. You know, we often say that when we're trying to get people to our table, but it's about the tables you and the coalition members go to. And I'd love to hear some more examples of that.
Well, I think what we've learned is that key decisions that influence health in any community take place in different arenas. So when plans are made for road construction, we have to attend the Department of Transportation hearings and follow-up meetings. When decisions are made in our schools, we have to attend meetings with principals or go to the school committee meetings, which we attend on a regular basis. And of course, some of our key meetings are held by the City Council or its Ordinance Committee when it comes to changing policies and regulations within the city. In some cases, we've actually helped citizens organize a new meeting, such as one that we created to advocate for improvements in our parks. So if there is already a table, then we need to go to it. And if it doesn't exist, then we have more work to do to organize one. But it pays off in the long run because there's now a decision-making group who can move our health agenda forward.
I wouldn't have thought more meetings were the answer, but actually you're proving that it can be, right? So share with us a few more examples, if you would. I know you have many.
It's all meetings. I'll tell you, anybody who gets into this work will find that you learn more and more and more. You find corners of the community you never knew existed, and it's really an interesting process. I'll give you an example of our infrastructure changes that have required us to get to know a whole new set of people, including the folks in the planning department, the Department of Public Works, and even the water department, who we learn controls when new streets are planned, because it begins with replacing our aging water mains. So to get new sidewalks, we have to talk with the water department. When it comes to major developments like the construction of a brand new walking and bicycle trail on a railroad bed that runs through the city center, which is about to begin this fall, we've had to get to know many of our state planners and contractors, in addition to the legislators who helped to get the funding in place. I would suggest that part of anyone's public health education includes some engineering courses along the way.
Great. More and more as we work in the physical environment, we are finding people working with community developers and planners a lot more. So this is significant. Great story of things, of real solid work getting done in your city. Dave, at this point, Karen has another question from one of our viewers we'd like to ask.
Yeah, thanks, Kitty. So Dave, we're hearing from some folks who are wondering specifically about the business sector, and we saw that in our poll that we just had a little bit ago, that investors, the business community, that was a little lighter. So what have you done to successfully engage the business community in your work?
Well, I'll tell you, it's a real challenge. We found that the business community was not really all that interested in embracing health. They had many other things on their agenda, largely just keeping businesses open and attracting new businesses to the community. And though we thought improving health would be a no-brainer, they didn't see it that way. So what we did was work to create an arena where we could engage businesses in something they needed. We got a small grant and worked with folks on helping small businesses create wellness opportunities for their employees. Now, we have write a column every month in the Chamber of Commerce newsletter, and I think we've come to their table by responding to some of the things that they need, and that's really helping. We've gone to businesses and asked about their interests. We were told that health wasn't a priority, but we've now demonstrated that we're willing to meet their needs, so that's improved our credibility. And now we have a regional worksite wellness collaborative that plans regular trainings and gets human resources personnel to the table from a number of local companies that help us address employee health promotion.
Great. That's a great example, Dave. Thank you. Another group that people often want to engage but aren't sure exactly how to do it effectively is working with young people. I think Fall River has worked for many years with great success in tobacco policy change, with youth leading the way. Is that correct?
Absolutely. We invest probably half of our time working with young people, since we realize that the health status of our community really depends on what today's teens will be doing over the next 20 or 30 years. 5 years ago, we were only the second city in the country to adopt a youth bill of rights that has given our young people a seat at the table on many of our city boards and gives them direct learning experience in how decisions are made. One of those young people who started his involvement in some of our programs when he was only 13 was involved in a successful effort on the part of our youth 3 years ago to get the City Council to pass a ban on cigarette sales in all of our pharmacies. I think you see him on the in the lower left-hand picture on the slide. That's when Jazel appeared in front of the City Council and who was leaning against passage of that ordinance, but he reminded them of the passage of the Youth Bill of Rights several years prior and their promise on the part of the City Council to protect the health of the city's youth. The ordinance then passed on second reading 5-4, and that young man has since completed his undergraduate degree in Providence and returned to the city to run a successful campaign for city councilor last year. He now chairs the ordinance committee before which he appeared 3 years earlier.
Wow, that's a terrific success story. Well, congratulations to the young counselor. That's really wonderful to watch how your work with someone has helped provide a leadership opportunity and a path to success in your city. Dave, we're having a few questions come through right now that I think we'll ask Karen to present to you.
Sure.
Yeah, Dave, we've had a couple of folks chiming in asking questions for just a little bit of clarification about how your work is funded and your staff positions, whether they are funded through grants or are they part of a municipal budget. So just, I think we touched on it briefly at the very beginning, but can you just walk us through a little bit about your funding structure?
Sure. If you're not from Massachusetts, you've probably never heard of what we call Determination of Need Factor 9 funding. But this was set up 20 years ago and by the former Commissioner of Public Health, Commissioner Mulligan, and he had a vision that any community that needed to build new hospitals clearly needed to invest some money in health promotion and prevention. So attached to any major construction project where hospitals are expanding both their buildings and their equipment, they have to pay a local organization 5% of the total cost over a period of 5 years, or 1% a year. Now that's not a huge amount of money. We started out with $12,000 10 years ago. That funding is now up to a little over $200,000 a year. But that has enabled us to do what many communities have not been able to do, and that's to employ staff over a long-term period of time, so there's some continuity, and I think that makes a huge difference to have an organization that really can be the backbone and organize and give us the opportunity to apply for other funding and kind of keep the trajectory going. Now, right now we're currently funded through about 2020, which gives us the kind of longevity in planning that lots of communities struggle with.
Wow, that is very significant. So that was the foresight of a commissioner 20 years ago, it sounds like, in setting up something that could consistently gain in its support of communities. So that's really amazing, and I don't think there will be too many people among our audience who have that kind of funding for that long a time period. So that is significant.
But I would say it's certainly something for people to work toward in every state and community across the country. I know the Robert Wood Johnson Foundation's efforts toward building a culture of health. There's no reason why every community can't have some kind of ongoing funding, whether it comes from bottle bill tax increase or something of that sort, so that at least a few people in every community can assume responsibility, not for doing all the work to improve health, but to organize the resources of each community so that they can improve health.
Okay, it's a great aspiration. Thanks, Dave. Well, we were talking a bit ago about advocacy messages, and I think one question that we've often heard is that people don't think they can do advocacy. They feel as though they're restricted. Can you can you just tell us, how do you help people know the work that they can do and the work that they can't do when they're working on a policy campaign?
Well, I realize that that many people who work for publicly funded projects have clear restrictions on advocacy, so it can be an issue. And yet, most coalitions have at least one member organization who does have the ability to speak up on policy matters. So by having a coalition, you get those who can speak to speak for those who cannot. I would suggest that each coalition take it upon themselves to learn about the lobbying restrictions on them. Remember to find out about all the advocacy activities that are allowable, and there are many. Of course, our job should always be to enable others to advocate. We can all train people how to advocate, and we have run a number of projects that do just that, like a project we did to get people to advocate for healthier food choices in their work sites.
Great, that's great advice. Also remembering that policy may happen on a citywide or statewide larger legislative level, but also in your work site or in your organization or coalition even. So these are great bits of advice here. So another question is, how about, and you've talked a little bit about this with your business leaders who say that their work really isn't about health, but how do we encourage those folks to actually not only be working in this realm, but really advocating in this realm?
Well, I think the best results happen when we see others advocating for health in the work that they do. We're really successful when we hear others pushing to get health in all policies or advocating for things like complete streets. And we're hearing more and more of that. Even if people advocate for the right policies without necessarily connecting it to health as the first concern, it still gets the job done. Our bicycle committee, for instance, wants to see improved conditions in our streets so that they can ride safely. Some of them say that they ride because it improves their health, but most simply like to ride. That's okay.
Sure. Whatever your passion drives you to, right?
Right. As long as it leads to healthy lifestyles.
Absolutely. Well, Dave, I know we have more audience questions we want to get to, and so I have one last question. What did it mean to Fall River to win the Robert Wood Johnson Foundation Culture of Health Prize?
Well, I can't say enough about winning the Culture of Health Prize, Kitty. It's done wonders for our self-esteem and our assurance that we're doing the right things. Just going through the application process was immensely instructive, as we rarely get a chance to tell our whole story to a group that's truly interested in what we're doing. Now that we don't have to explain ourselves to community leaders because we've been recognized outside our community for the work we do, it's really easier for us to get a foot in the door. I'd urge any community that's taken up the challenge to improve health in their community to seriously consider applying. Not everyone wins the prize, but I'll assure you that everyone who applies ends up seeing themselves in a more positive light.
Oh, that just sounds wonderful. David Weed, thank you so very much for sharing the story of Fall River and the Healthy City Fall River Coalition. I know I've learned a lot from you and from your partners as well on how to bring the County Health Rankings model to life. Working as you do across the health factors, you have multiple partners from different corners of the city, and you've just been making great strides in Fall River. We're going to turn now for questions from our audience, but before we do, I'm just going to have us look back once more at these reflection questions. We hope that you all have felt inspired to reach out to others and take your next step wherever you are in taking action. So please use the chat box to send us questions. Tell us who you'll share this information with next, or send us an idea for action. So I'm going to let Karen lead us through any of the questions that are coming in as they do. And Dave, again, thank you.
Thanks, Kitty. And I wanted to point out a couple of links that we've shared with you about the prize, so you can learn about our 2014 prize winners. You can review the call for applications or watch our informational webinar that we had. Let's see, I think it was last week. Yeah, last week. And so you can look at that information and consider putting together your own community application specifically about Fall River. If you want to learn more about the kinds of things that they included in their application, you can watch a great video about Fall River. I've just included a link to that, and read a little bit more about what they've done in their community on the link that I just shared with folks. So there's lots of great ways to learn more about the prize, learn more about the prize winners, available through those links that we've just shared. Dave, we had a question about how did you work through barriers to really create some solid collaborative efforts? So you've laid out a number of partners that you've begun to work with, or that you've been working with over the years. How did you work through some of the bumps and the barriers along the way to really create that solid collaborative relationship?
Well, I think, as I mentioned earlier, we work with all of our partners in the planning process, so we get people to the table from the beginning. Once we've identified the role that they're going to play and what's in the action plan, then it's a matter of continuing that collaboration and working alongside them. Really, very few projects that we simply turn over to somebody and expect them to do that all. The 3 staff members that we have go to practically every meeting there is in the community and work alongside people. But we really work hard on making sure that each of our task forces is fully responsible for what they're doing. They get a budget to work with. They set their own priorities, develop their own team, bring people to their table, and work alongside all the partners there. So the nice thing about the task forces is that they're really focused on sort of narrower objectives, like substance abuse, for instance. So they can really dig in, and that's where a lot of the more meaty objectives get accomplished.
Great, thank you, Dave. That's great additional information. Do you have, so a lot of the examples that you talked about, a lot of the partners that you brought on board, you mentioned that you had grant or funding opportunities that really could help meet their needs. Do you have any examples of being able to bring partners on board where maybe you weren't there yet, you didn't have a funding or a grant opportunity that you could help provide them with, and other strategies that you've used to bring people on board?
Well, if you're saying that we lack funds to do a lot of the things that we do, that's absolutely the case. But a lot of times what that means is partnering with people to look for those resources. And we found collaboration in places we never expected to find. One of the projects that we've been working on over the past couple of years is to address the needs of people in a couple of our motels in the community who are placed there because they're homeless, but are given no other resources than the room that they're in, and these motels are out in suburban areas with no resources whatsoever. But we worked hard to find other collaborators with that, and now we have one of the Episcopal Diocese groups that's working with us, and they themselves are organizing other resources, so that we're coming together with folks that we hadn't partnered with before because we have a new problem. I think that's one of the ways that communities discover their resources is by, looking for what needs attention, and then looking for people to come to the table and help to resolve the problem. This isn't easy work, but if you don't clearly announce what the problem is and what the resources needed are, you're never going to get anywhere near resolving the issue.
Great points, Dave, and I appreciate the thought of finding partners where you maybe don't expect to. I think that's a really great lesson to be learned, and I think a lot of communities who have started to look to non-traditional partners have found that to be true as well, that they can find great partners maybe in places that they weren't expecting to. We've had a couple of questions from funders who are trying to support this kind of work in communities. So when you think about what you've been able to accomplish in Fall River, what can funders or those who are providing technical assistance to communities do to foster this kind of work?
Well, my first response would be to give us the money and don't tell us what we have to do. We'll figure that out. But that's not really how it works best. I think every funder, and we've had some mini grants and other opportunities to give out funding ourselves, and funders need to be responsible, and they want to find partners who can carry out the mission that they have, but they don't really, and they shouldn't, walk away from their relationship with the people carrying out the work. So I think one of the things is to make sure that funders have a way of staying involved with the project as it goes. It doesn't mean that they do all the work, but certainly being at meetings along the way, getting reports in terms of how things are going, helping to problem solve. I think there's an earlier webinar that you put on that talked about the role of funders, and giving money is just one aspect of that role. Often the funders really have a lot of other resources, have ideas, have connections with other people, can help you connect with community leaders, can help you connect with other projects. Those are all resources that funders can bring. So I would really suggest that funders look for people who like to work in collaboration and who aren't just asking for the money and to be left alone.
That's great. Thank you, David. I just posted a link to that webinar as well. It is one of our archive webinars, Funders as Community Partners, so thanks for that reference. That's a great reference. So Christopher is wondering, Dave, if you could share if you've used a certain collaboration model in your work, in your community-based approach. Is there a certain model that you've used to really build your partnerships?
I can't say that I have one particular theory. I've worked in my early days with Tom Wolfe, who'd done a lot of work on coalition building, and people might want to reference him, and plus the wonderful resources that are available through the Community Toolbox. Anyone Googling that will find that immediately. So there are a lot of resources in that regard. So I wouldn't say that we have a strict single model, but we follow the principles of the World Health Organization in terms of what makes a healthy community. That's part of our mission statement. And I think by helping people to understand that that every community has within it the capacity to solve its own problems. I mean, that's a powerful statement, and it's often getting community members to believe that that helps them move from paralysis to action. And that's, we often talk about poor communities. That Fall River is a poor community, and I disagree with that. Fall River is a very rich community, and its richness is not in its material wealth, but in the attitude, willingness, hard work, collaboration, and shared successes and celebrations and joys that come from doing this kind of work in the community. It's community is very rich when it can come together and work on things together and see the results.
Thank you so much for that answer, Dave. And I'm going to post a link right now to our Work Together guide, and some of the resources that Dave mentioned, some materials from Tom Wolf, some materials from the Community Toolbox. You'll find some of those along with other tools and guidance for working across sectors in our Work Together guide. So I'm just going to share that with folks as well. It's another great place to start linking in and looking at some resources. You'll also find we look at a lot of collective impact resources, so you'll see some of those in there as well if that's something that's of interest and new to you. So Ryan is asking about how often you've measured progress. Was progress inclusively agreed upon? Like, did all of your stakeholders talk about what measures they were going to be looking for to understand progress over time? So can you just talk a little bit about what your measurement has looked like and how often you've measured your progress over time?
Measurement in this business is always a challenge. The biggest challenge, of course, is that the kinds of changes that we're looking for are ones that don't take 1 or 2 years. They take 1 or 2 decades. And it's important to kind of keep people apprised of the fact that if you continue to work at activities over time, that the results will emerge over time. We track things like smoking rates. Most communities have access to the Behavioral Risk Factor Surveillance Survey, and I know much of the information that's included in the County Roadmaps rankings are based on a variety of measures that are available to communities across the country. But if you're expecting to see a 5% drop in smoking rates in the next year after, whatever policy change or intervention, it's not likely to be that dramatic. Though I will say, we were shocked. We did a study when Massachusetts instituted its first no smoking in the workplace law, and we decided to do a follow-up study of heart attacks, myocardial infarctions, at our 2 hospitals, and we're shocked to discover that the MI rates went down 23% in the first 6 months after the passage of that law. That's a helpful story. That was quick, and we were able to get the measure within the first 1.5 years after that. So we've been able to use that as a good example of how, when you change policies around smoking, that you do get pretty rapid benefits. And that wasn't just for smokers, by the way. That was for a lot of secondhand smoke victims, if you will, in that. That kind of information helped to pass the, our teens led an effort to get the no smoking in the pharmacies passed in our community. So you can't buy a cigarette in any of our drugstores in the community. But some of that comes from, helping people to see that when you make those changes, there are real and occasionally immediate results. Problems with overweight and obesity are long-term efforts. Crime rates, I think, can be responsive. We've measured our youth violence rates for those under 26 years of age. We saw a 37% reduction over 4 years after we instituted a number of very comprehensive efforts with a select group of very high-risk youth. We can't necessarily say that that was only due to what we did, but I think it's fairly convincing when you make a major effort in the community and you can see some numbers change. That's good information to put in front of community leaders and say, see, the investment does work.
Those are such great examples, David. And one of the points that you made really reminded me of your talking points were almost as if they came right out of our measuring progress tool, and I know that they didn't. So I posted a link to Measuring Progress, which is a great resource that we have on our site that really it highlights so much of what you said and so much of what your experience has been about that change really does take time. And so how do you find the measures that you can look at to see the changes in shorter time periods while you're also watching for those longer term changes and really thinking about what kinds of measures you can look at to understand that. So the Measuring Progress provides a little bit of guidance on that, and it's a great resource if you're trying to think about how do we measure our progress over time. Great point, Dave. Thank you so much. We have one final question before we wrap up for today, and this is so much of what we've talked about today is really about building these relationships and having creating a collaborative effort. To do that, it really takes time to build relationships and establish trust when you're starting with new partners. And so we're wondering, can you talk about how long does that take? How did you find the time? How do you make the time to build those relationships, to develop the trust that you need to have when you're starting out with new partners?
Well, with some partners it takes about a day. Other partners a bit longer. There's no single rule on that. I think a lot of it depends on what people bring to the table. If they're heavily invested in, we found partners who just, it's like, where have you been? We're all working on this stuff together, and those are easier relationships to build. Other ones where there's more resistance, where there's a sense that we don't get what they're concerned about and they don't get what we're concerned about, and that takes a long time. It takes a lot more effort, and we have to be strategic about who we work with. A small group of people relative to the rest of the community can't do everything and be everywhere. So we have to try to pick our, not our battles, but our efforts, kind of one at a time. And some of the things that we talked about with the businesses and work sites, that's been a 6 or 7 year effort. And we still have a long way to go with that, but we knew from the beginning it was important, something we needed to do, and we're pleased that we're getting some results now. But that didn't happen overnight. That's taken a good while.
Wow, that's very insightful. I just love this idea that you have to understand and recognize the concerns of the others, and they have to understand and recognize yours before you can begin to find that common ground on which to build a trusting relationship. So that's a really important piece, Dave. Again, I just want to thank you so much. I feel as though we could keep pummeling you with questions for the next hour and a half and still sit here with more questions rolling in. So thank you so much for your time. As we close out, as I promised, we will jump to a couple of final slides about the Robert Wood Johnson Foundation Culture of Health Prize. First, I just want to point out that you can follow us on Twitter. You can certainly like us on Facebook. And we have an e-newsletter. You can email to us to subscribe, and that will provide you direct into your inbox information about upcoming webinars, any opportunities to engage with County Health Rankings, where we are and where you are as well. So we do travel about, and we'd love to meet everyone. The Robert Wood Johnson Foundation Culture of Health Prize, as we discussed earlier, it celebrates what communities have done well as how they have done it. So Dave has aptly represented his prize-winning community of Fall River here today, and you'll see on the screen the 6 criteria that are really central to the Culture of Health Prize. These criteria serve as the lens through which all applicant communities' submissions are judged. You have some links in the chat box for how to get further information about this. They're also on your screen now. The call for applications is available. The informational webinar that was held last week is archived, and you can listen to it. You can find it on our website under the Webinars tab, where you will find all of our archived webinars, including this one, shortly after they've been aired. The applications for the Culture of Health Prize are due September 17th at 3 p.m. Eastern Time, and we encourage communities to, at the very least, look into that application and review those criteria and see how well you're feeling about the work that you're doing and whether or not this is a great opportunity, as Dave said, to be introspective and feel good about the work in your community as it goes forward. A few final acknowledgments. As we mentioned at the beginning of the webinar, the County Health Rankings and Roadmaps program is the result of the contributions of many partners. We're listing just some of them here, and we're really grateful for the support of Robert Wood Johnson Foundation, which allowed us to bring this webinar to you. Our final slide at the beginning of this webinar, we asked this essential question. We hope you feel you have some of the answers and maybe even some new questions that will give you food for thought as you move forward in your community health improvement efforts. Thank you for joining us on this webinar, and we look forward to hearing from you in the future.